And here is the question. If you have read and understood the question, kindly begin your communication skills station.
Hello, good evening. I'll first wash my hands and hello, good evening. I am Muhammad
Good
Kashif,
evening.
one of the doctors who is in charge of your kids of kids. May I know your name and date of birth, please?
Huh. Doctor, I am Jane, 45 years old.
Mother of.
Okay,
Yeah,
Jane.
mother
So
of
may
this.
may I ask you that? Okay. So may I ask you that what do you know about your child condition?
Doctor, why are you asking me all these things? I am here because my child is in theater, they said. So I don't know anything about that.
Yes, I'm sorry to inform you that, but as you know that your child was brought in a critical condition after a fall,
Doctor,
and
I
we
Your
have
network, yes.
resuscitated him and given him IV lines, IV fluid.
Doctor, what are you explaining?
Yes,
I
ma'am.
don't even know what you're talking about.
Hello, do you understand me?
Doc, I am right now, I am so frustrated.
Can you listen to me?
I've been called that my child is in theater. I don't know what happened because he was not with me. He was with his father, and then I don't know.
Yes, I do understand your anxiety, but your child was brought to the hospital in a critical condition after a fall. And me and my team has given him IV fluids and we have resuscitated him. But and the initial
Network is gone.
Network
Mm,
disappeared.
yeah,
Can't hear you.
yeah, I can get you now.
investigations showed that of spleen. So regarding death, we had to take a difficult. So this same was communicated to his biological father-in-law. But yes, we would have waited if your child's condition had allowed us. But
So
as you know, and as I have explained you,
so what did
yes,
you say
yes,
is
please.
actually wrong with my child? What happened that you have to take him to the theater?
Yes,
Okay.
your child was brought after a fall, and on examination, he had a bruise over left lower side of his chest. And on giving IV fluids, his BP was slightly improved. But after, as we did his fast scan and ultrasound abdomen, we were able to see that there were free fluid in the abdomen, which
Doctor,
means
what is
that
all
there
that
is
fast
a
scan? What is all
yes.
those? I don't understand what you're saying. I really don't. I
Okay,
want
try again. Yes, explain once again to the mother.
Yes, what do you want to know?
you were saying all fast scan. I don't know what fast scan is. I don't know. I don't know all that.
Yes, yes. So I'll explain it to you. So when whenever a patient comes after a fall or after a trauma, we do ultrasound abdomen. Ultrasound is a machine in which we use a water gel to look inside the abdomen and inside the chest if there is any bleeding. Can you understand me what I am explaining to
Yes,
you?
yes. Now I get what you're saying.
So, oh yes, yes. So as we did the ultrasound abdomen of your son, so we had a suspicion that he is bleeding internally.
Oh my God.
So I am sorry, but we have to take a difficult decision to operate and to
So doctor,
control this
is
bleeding.
this a very serious condition? Because I don't know. Is it very serious? Is he going to?
Uh, yes, this may or may not be a serious condition. That's why, but it is critical, and condition of your child is serious for the next 24 to 48 hours. That's why we had to take a difficult decision to operate upon him early to prevent him from going into further damage.
My concern is he was with his father and then we had like divorced, so I wasn't there. So it's actually a big concern for me.
Yes, you are right. And about that, I would like you to discuss this with his father and with the social services because this is a very big trauma to the child. So, as medical doctors, we have the responsibility to inform the social services about this. Do you understand what I'm saying
Yes, I
to you?
understand. So, doctor, you said you're going to during the operation, they're going to do some procedures. So
Yeah.
after this, how are we going to leave? Is there anything that we should be concerned about?
Yes. Uh, if there is a trauma or a spleen is damaged, we'll have to take a difficult decision to remove the spleen to control bleeding. Because if we leave the spleen there, it may again lead to further bleeding and lead to a serious condition. So after that, you have to take care of any infections, and also that your child will have to adhere to some medications, which are prophylactic medications given to prevent from infections. Otherwise, your child will grow well and he will have no other problems, but
Okay.
he will be susceptible to infections.
Okay. So, doctor, when would I be able to see him? Can I see him now?
I fear that you cannot. I cannot allow you to go into the operation theater because it's a sterile area and it may lead to infections to your child too. But yes, you can see your child from a window, and it will be far away, but you can see him. Do you want to know further? Do you
Okay.
have any other concerns?
No, I don't have. I'm just
Yes,
waiting for
you
feedback.
asked, is the consultant expert in this
Okay, yes.
surgery?
Is the consultant an expert in because
Uh,
this is my only child.
yes, I do understand your concern, but please be assured that our consultant is fully professional and fully experienced, and these types of surgeries are done by the consultants with the best experience and the best
How many has he
expertise.
done? How many has he done unsuccessfully?
To be a consultant in such surgeries, he has to have done at least 100 surgeries, or maybe more than 100.
Okay, okay.
And please be assured that he is fully experienced.
I trust you. Okay, no problem.
Okay, well informed. Thank you. What should, all right, Dr. Fatumata, can you please give the feedback first?
Yeah, so thank you. I think the network was disturbing him one.
Very much,
Yeah,
yes.
so we were skipping some things, but also when he was giving me lots of jargons, and then I could not understand, and then he didn't explain to me the what in
Yeah,
school about the concern, the spleen, what it was, and then where it's actually really located, and then the complications of it until I had to probe him.
yes.
Uh, think he could have just explained all that to me, and then or asked what I know about this the injury also. Yeah.
Yes.
So,
And how he should have ended his conversation
yes,
with you.
yes. At least he could have told me about the his number. He would have left
Yes,
at the
yes,
North Station, and then so if I have any, because I'm really anxious, I could call him also.
yes,
Okay. Yeah.
yes. Anyone else want to add?
Ma'am, I would like to say that
Yes, please.
first of all, he used some technical term like fast scan and other
Fast
thing.
scan, yes.
Yeah. A second thing that there should be more question like when I will take him to home, or when
I think she
when I
asked,
can see him, like that.
she asked those, yes.
And
Discharge,
at
I don't
last
know.
he should
Yeah,
So
means
discharge I did not. Yeah.
you didn't ask.
yeah,
Yes,
you
that should have
yeah,
been
yeah.
asked.
Yeah.
And the means he should summarize the case at the last.
Yes.
And then he can say, I give you my number to the nurse for
I'll
you,
leave my
something
number
like
with
that.
the nurse. Yes.
Yeah, I'll
So if
leave
you
my
have,
number with the
yeah.
nurse. Yes,
So if
yes.
you
After
have any
summarizing
query.
the case, yes.
And in 30 seconds, had to summarize. Yes, Dr. Kashif, do you have
Yes,
any question?
yes.
Good.
Yes, you're right. I should have summarized and ask for any other concern and give my number. It's
Yeah.
right. Actually, the time was short and the bell was 10. So I
Bell
should have
rang and yes,
mentioned it.
yes.
Yes, I should have mentioned
Network
it.
was also bad.
But
That's why maybe
Yeah.
you also
yes,
got
network was.
disconnected. Yes, because that distracts as well, network coming and going,
Yes.
not being able to communicate enough with the other person. So,
Right.
yeah.
Thus, I was not sure about the mother of the patient. She didn't look so anxious to me.
He was more angry actually.
Angry, yes.
Yeah. You have to console because you didn't informed her about her child's condition. That's why she was angry.
Yeah. She came all of a sudden and then, yeah.
Yeah.
Plus, she explained herself that they were separated, they weren't together. And father
Yes.
has given
Yes.
the consent, so that was most alarming kind of thing.
Yeah.
Yeah. Good, very good. Okay. Started the timer, and here is your question. It's very similar, but it's not the same station. Right. If you have read and understood the question, kindly begin your communication skills station.
Hello. My name is Dr. Jaita, one of the surgical doctors on duty. May I please confirm your name, please, and your relationship
Uh,
to the patient?
Hello. Yes, doctor. That is my daughter, which you're talking about. I am Mrs. Uh, Jain.
Oh, Mrs.
Uh,
James, I'm so sorry about your daughter. She was brought in to us, but I want to ask you, what do you know about her condition so
uh, Actually, doctor, I was working at my factory, and when someone informed me that my daughter has got admitted in the hospital,
far?
it was really my fault. Actually, she has got some
Good.
stomach ache before, tummy ache, and at that time I thought it would be simple, and then I went to work and put my daughter with my neighbor, and now I don't know what happened to her really.
I'm so
I'm
sorry
very
about
much.
that. I'm so sorry.
Yes.
I'm so sorry, Mrs. Jane. You don't have to feel bad about that because this is not it's not your fault in any way. So your daughter was brought in by the neighbor, like you said, because she was having this stomach pain. That's why your neighbor brought your daughter.
Okay, doctor.
Yeah.
So
So
what she has got, what happened to her? I want to know exactly
yes.
what.
So when she came in, we did all the quick history, and then like we took her quick history, and then we did some examination trying to check what's wrong with her. But when we tried to do some small findings, like some small investigations to see what is to confirm our suspicion, we found out that she has what we call appendicitis. Do you know anything about appendicitis? Have you heard about it?
Doctor, what is this appendicitis? Are you sure my daughter has the appendicitis?
Yeah, from what we have done, from the investigations that we have done, like
Oh
some
God.
scannings, we found out that it's suspicious. It's not like we have confirmed it, but we're thinking it will be that. So
So, doctor, is it dangerous for my daughter? Is it dangerous?
it could be dangerous if not taken care of. But right now we don't know how it is. Though well, from investigation, she has a appendicitis, and then when we open, we will know what's going on, and then we can.
Okay, doctor. So you,
Sorry,
how you operate her? Will the wound will be bad for her? Will be disfiguring?
yes. So so
Uh,
so so before we get to that, do you know what appendicitis is first, so I can explain to you?
I just know that there is something inside the tummy appendix,
Yes.
and it got some problem. That is what I know.
Yes, so appendix is it's a part of the bowel, like the tummy, just the
Okay.
end part. Yeah, so it's small. It's a small one. It's like a worm. It is there. So when it gets infection, that's the time that it can cause appendicitis. So that is what your child has. And then, so you were asking about the whether the wound, the infection. So there's it depends on what we find during the operation. So if it has made a hole, and then the whole abdomen is the whole tummy is being affected, that the risk of infection on the wound is high. But if not, if it's just the appendix itself, and then there's no hole there, then that one, the risk of having wound infection is very low,
Okay,
as you
doctor.
asked.
Any other problems you could have due to this operation or due to this appendicitis?
Yes, there's some risk because is a lady, and then she has some because of her fertility. It's not like it's going to
Oh
cause
my God.
any stopping, but
Even
like
she could not get pregnant
no,
after
no,
this operation.
we're not saying that, but there's a risk that she could not. But we're not saying that she's not going to get pregnant.
Oh my God. So how will she get married and get pregnant in future?
No, like I said, it's not like she's going to get in, not going to have a baby. She can have a baby, but we are saying that there is a small risk that she might be having difficulties in getting pregnant, but she can get pregnant.
And doctor, I heard that the surgeon is Mr. Mann, and he operated my husband a few years ago, and after operation, my husband died. So I'm really concerned about my daughter. I don't want Mr. Mann to operate my daughter. I'm
I'm
very much
I'm so
worried.
sorry. I'm so sorry about that. I'm so sorry about your husband. But Mr. Mann has operated a lot of appendix cases. Situations might be different, but this he has operated a lot, and then we don't have those kind of incidences.
But
I am sure.
Mr. Mann operated my husband. He had a cancer, and after that operation, he died.
Yeah,
I'm
it
really
might not be
concerned about.
related to the operation, sorry, because you said that your husband had cancer, so it's a different thing. So Mr. Mann has great experience, especially with appendicitis. He's a consultant, and he has operated more than 100 cases.
Doctor, can I see my daughter right now?
Right now she's in the theater. Operation is ongoing, but as soon as she gets to the recovery room, I will get you to the recovery room to see her. I'm so sorry. I'm so sorry about everything.
Oh, really? Okay, doctor.
Do you have any other questions?
No, not right now, ma'am. Not right now, doctor.
Okay, so I want to summarize to you what we have discussed, whether you understand everything before we go on. Is that okay?
Oh, yes, doctor.
Okay, so I told you about your daughter being with us, and then that she has what we call appendicitis, and then she's in theater right now. And then we are going to remove the appendix, and then whatever is inside, we try to clean up the tummy as well if there's any hole there. And then also I explained to you about the complications that might be at risk, which you have asked me of about her fertility, which I've also explained to you. And then you have also asked me about the competence of the surgeon doing the operation, which I've also given you assurance too. It's that all that you have asked me, right?
Yes,
Or is that all we have
yes,
discussed?
doctor.
Okay. Good. I'll leave my number with the nurse at the desk. Be rest assured that you can call me at any time, and then I will answer all your questions or any doubt that you have about your child. Is that all right?
Yes, doctor. Thank you, doctor.
Okay, my pleasure.
Good, very good, within time. Yes, Dr. Suman, would you please give feedback first?
I didn't hear the bell. Is the bell off?
It just went.
Just went. Okay. I think, ma'am, she did it well. Almost
Yes.
all questions, whatever I asked, she answered that.
Has she missed anything?
And
Or could she improve anything?
I see something like I asked like about my daughter getting pregnant in the future. She should explain that about that she has two fallopian tubes, one on either side. So
Yeah,
if
can get blocked. So
one
they are
gets
two.
damaged, another one will work.
Yeah,
Yes,
good.
I
So
should have
there is
explained
no
it
need
like
to,
that.
Yes.
no need to worry.
Around the
Yes.
bush.
No, but this is something she has to learn. And one more thing, when you approach the patient and patient presented, as you realize patient was crying and worrying and feeling guilty. So here mother will be crying in this station. So you have to offer her tissue. You have to offer her chair to sit without touching the mother. You have to console her, make her feel comfortable, and then start telling the
Okay.
whole scenario. So
Okay.
this
Yeah.
something extra acting you missed.
Have to do.
You
Okay.
have to know and you have to do, which you didn't do this
Tissue.
time.
Okay.
Yeah.
Yeah.
You just think that the mother is standing.
Standing, assume mother is standing, you have come to greet
Okay.
her, and then you are making her please sit down. Do
Down.
you need tissue? Do you need a glass of
That's
water to
okay.
drink? Yes, to make her feel comfortable, and then without touching her. This is for boys as well, because people can feel offended by becoming physical. So this is something very important.
Yeah, that's true.
This is different from the first station. That's why I put them together, so you know the difference while
Yeah.
you're doing it together.
Yeah, that's right.
One patient is mother is feeling guilty, and the other one was mother was frustrated, angry, or aggressive, or whatever, or anxious. So this is different.
I should empathize. Yeah.
Yeah. So here you have to cool down, waste one minute to settle mother down,
Okay.
and then begin. And then those two fallopian tube ones. That if even if one gets blocked, you still have other one
Another
open. So
one.
still the chances are there. So it's not a big deal. Good,
That's
very
right.
good,
Okay.
very good, very good.
Yes. Yes.
Thank you. Thanks so
Very
much.
good, very good. Yes, thank you, both of you. Okay, started your timer, and here is your question. Right. If you have read and understood the question, kindly begin your
Yes.
communication skill station now.
Okay. Hello, Mr. Tom.
Hello.
I'm Dr. Zaid. I'm one of the surgical core trainee here in the department. I have been told you have some concern about stopping warfarin. Could you tell
Yeah.
me more about your apprehension, please?
Good.
Yes. So, doctor, basically, I've been put on this medication from my doctor. I had a heart surgery about many years ago, about 30 years ago, and I've been put on this medication from my doctor back then. So he told me that this is a very important medication and that I should never stop taking it. I should take it regularly because otherwise there is a problem. There's complications that can arise in my heart. So I'm very concerned when this person asked me to stop the medication. So yes.
Yes, you have right to be concerned. Just let me explain for you first what's the warfarin, what's the mean of warfarin.
Okay.
Warfarin is a medication that working to make your blood is thinning and prevent
Okay.
production or and prevent formation of clot, especially with your case in your artificial valve.
Okay.
And we are not stopping warfarin without giving you replacement by other medication. But what is the problem with warfarin? Warfarin is have a long time to work. That means
Okay.
need for 5 days to stop before operation. We will stop this warfarin and give you another medication. The same action will make your blood thinning and prevent formation of clot in your blood or your valve. But this medication, we call it heparin. It's injection type and give you by injection. And
Okay.
we can stop 12 hours before surgery. I'm
Okay.
clear so far?
Yes, but I don't understand why I have to. I mean, so you're telling me that I have to stop warfarin. When should I stop it, doctor?
Yes, we need to stop it 5 days before surgery and give you
Five
this,
days.
yeah, and give you
Why
this
can't we
new
stop
one.
it one day before and then we just do the surgery and then I can start it after? Because, like I said, my doctor said it's very important that I take it every day. You see.
Yes, this is a good question because your warfarin is long action. We can't
Oh,
stop it 1 day before surgery. We should stop 5 days because if we have a bleeding inside surgery, we can't control this bleeding because this drug is still working for a long time. We should stop five
okay.
days and give you this new one, heparin by injection. Heparin is a short time action. If there is any bleeding, we can control this bleeding.
Okay, doctor, but I don't know if you've had a chance to look at my file. Uh, who's gonna be? I mean, I'm blind. You see, I can't see. So who's gonna be in? I mean, should I get admitted for this? Would somebody be injecting this? I mean, so
Y-
somebody will be able to do it for me.
Yeah,
The
yes,
injections, you see.
don't worry at all, Mr. Tom. In this case, we have a choice. We can admit you 5 days before surgery and give you this medication in our hospital, or
Okay.
we can also call a nurse to come to your home and give you this medication every day to be sure you are taking this medication and not miss any dose.
Okay. Yeah, I
Yeah,
think that I would prefer that, doctor. I would like to be at my home if you can arrange for somebody to come at home. I can, she can help me.
yes,
So when do we restart the warfarin? When can I have that?
yes, we will arrange that. Nurse come to your home, stop 5 days before surgery, give you an heparin injection,
Yeah.
and we will return back to warfarin after surgery when you are able to take oral food.
Okay. And you're sure there's no risks with that? I mean, you know the risks that I was told about. I'm really scared about that. You're sure it's okay to stop the medication?
Yes, it's okay. It's a normal. Do it with every surgery. We should stop warfarin, should
Okay.
start heparin, and we should again warfarin after surgery. When you are able to talk, you will also take your warfarin again.
Okay. What about my other medications? I'm on other medications. You see, you want me to stop them as well before the surgery?
Yes, after we are sure your blood thinning return back to normal, we will stop.
No, I meant other medications. I'm on other medications as well.
Yeah, yeah,
You want me to
yeah,
stop them as well?
yeah. We will stop them after your test is returned back to our range, therapeutic range. We will stop our heparin and continue with warfarin.
Okay.
Okay. Have you had any further question?
No, you're still talking about the warfarin. I have other medications that I'm on. I'm on diazepam and other medications. So I want to know whether you want me to stop them as well. That is what I've asked.
No, no problem to continue your other medication like
Okay.
this spam. You can take it to the morning of operation with
Okay.
small sips of water.
Okay. All right. Yeah, I think that's all the questions that I had.
How long you'll stay in hospital?
Oh, yeah. How long
Sorry.
do you want me to stay up? I mean, will I be staying in the hospital after the surgery?
As your surgery is not big surgery, it's small surgery. Maybe will take 1 day, and just we will keep you in our hospital for more 2 days to be sure you are safe. There is no bleeding. There is no extra bleeding. You are take your medication normally. After that, we will discharge you within 3 to 5 days.
Okay. All right. So yeah, you guys know
Explain
what's
the
best.
procedure, how you'll make heparin stop and start warfarin again.
He did said that.
You did say that. Okay, sorry, I missed. Okay, now you can summarize your case. To your
Okay,
patient.
let me summarize what we are talking about.
Yeah.
We will stop your medication 5 days before surgery. We will send the nurse
Definitely.
to your home, give you warfarin. It's a new medication for blood thinner. This injection one. You will come to your operation. On the day of operation, we will keep you in the hospital for 5 days, and you will
Yeah.
stop new medication within this period and return back to normal medication is warfarin. Is that clear?
Okay. Yes, sir. Yes. Yes. Thank you.
Okay, thank you.
Thank you.
Yes. If there is anything else, you'll be leaving your number with the nurse. And
Yeah. If you have any inquiries or there is any question come to your mind, you can call me at any time. I will give you my number, and I will leave my number also with nurse come to your home.
Okay. Thank you, doctor.
Thank you.
you still have 30 seconds. I don't know how you saved this much time.
This is a relatively straightforward station, ma'am. It's
Yeah,
back
but
and forth.
still.
To
But since the patient was blind, so there was something
yeah.
special you had to show to the patient. Special
Yeah.
consideration. What is that? Who will tell me?
Sorry.
What was that? What was extra care that you had to take care in this station? No bell went. Can anyone tell me? Has Dr. Abhishek joined?
I think is it about the medication because he's not able to see?
Because patient is blind as well. So
Yes.
who would tell me? Dr. Sunday, good evening.
Hello.
Yes, Dr. Sunday, what is special about a patient who is blind? What extra you have to do as a candidate?
It's touch his shoulder when you are talking or something like that.
Good evening.
Good evening, yes. How would you make sure patient knows that you are there and you're talking to the patient?
We can touch his shoulder or hand when you are and
With
Take his
respect.
hand in.
With
Yes.
hand, yes.
Yes.
Not
Take
shoulder.
his hand in your hand. Yes.
Yeah,
Okay.
yes. So this is something important you have to remember, right?
Yeah. Okay.
And
Yes,
patient
and
has to be admitted 5 days
yeah,
before.
that he
Definitely to be
explained.
admitted. Yes.
Something with INR. Did you explain? I missed. I don't know.
yes,
No, no,
I
no.
told him
Explain.
about test, not
Okay,
ANR.
not
I test.
INR in particular, but test. Okay, very good. Okay, I missed. Good, thank you.
Thank you.
Good, thank you. Started the timer, and here is your question. Right. If you have read and understood your question, kindly begin your communication skills station.
Yeah, ma'am, I'll enter the room. Hi, my name is Dr. Sridhar Murli. I'm one of the junior surgical doctors here. Can I confirm your name and your age, please?
Yes, my name John Smith. I'm 32 year old.
Nice to meet you, Mr. Smith. Can I know can I know what brings you to us today?
Yes, doctor, I'm ready to meet Mr. Mann. Today, my operation. I'm ready.
Yes, sir. So unfortunately, Mr. Mann has actually sent me to speak to you on his behalf. He does give his apologies as well in advance. Unfortunately, he's been called in for an emergency surgery, and I'm afraid that we won't be able to do your surgery today. I'm really sorry to say that, sir.
Sorry, what you are saying? I'm ready.
Sir, yeah.
I'm ready for operation. How I can do this operation today?
I'm really sorry, sir, but unfortunately there was an emergency that came in this morning, and Mr. Mann has been pulled into that surgery. So we've had to cancel all his elective list for today. I'm afraid. So unfortunately, we'll have to postpone your surgery to the next available date.
No. This unacceptable.
I,
Really, is my pain is my knee is hurting me, and this
I'm
operation
really
also
sorry.
postponed 2 time before. You know that.
Yes,
Two
sir.
time
I
before.
did have
Yeah.
a look at your file, and I
I,
saw that
I
it has been
can't
cancelled
I
twice
can't
before.
really I can't really wait anymore. I
I'm
need
really
my
sorry, sir.
surgery today.
I'm really sorry that sir, this has happened again. I did notice that it has been cancelled twice, but unfortunately, it's the emergency take list. I mean, whenever we have a patient who's needs a more urgent operation than yours, we have to prioritize them because that's a more important, the more emergency surgery. I'm afraid. I'm really sorry about this.
Doctor, you can't call him now, please. I want to speak to him.
Unfortunately, he's scrubbed in theater at the moment. Like I said, so you could wait for that case to get over, but it's a long procedure that's going on now.
Okay,
He's
doctor.
busy in the.
Okay, doctor. I want to change this consultant. I need to know to transfer me to another one.
Well, if you wish to transfer to another consultant, that is your choice, and we can do that. But what I would advise is to stay with Mr. Mann, because the changing of a consultant will require him to give you another date, and he'll have to study your entire file, and that might delay your surgery even further, if I may say so. So
Okay,
I
doctor.
think the best.
Okay,
Yeah.
doctor. I'm happy. You do it.
Sorry.
I am happy with that. You can do it. You.
Yeah, I'm sorry, sir. I'm a junior surgical trainee in the department. While I am, I mean, in training for doing such procedures, but I can't do this procedure on my own. So and this your case needs to be done by a more specialist surgeon, which will be in your best interest.
Um.
So I won't be able to do it on
I'm
my own, sir.
I'm really
I'm
sad.
afraid.
I don't know what I can do. Okay, can you give me a
I'm so
date,
sorry.
a time I can come and you can do this operation, or your consultant? Just give me a date.
Yes, sir. As soon as Mr. Mann is out of surgery, I will discuss your case with him, and I will inform him about your.
Okay.
I mean,
When
the
I
fact
can
that it
come
has
back?
been,
When?
and we will let you know. We will give you a letter to yourself. We'll let you know when we can reschedule your operation for the next earliest available date possible.
Could you give me a special time and date I can come in this date?
Well, like I said, sir, we'll have. I mean, I'll have to take into consideration his availability, Mr. Mann's availability, and we'll discuss with him, and I'll inform you about the next date that we're going to fix for you, and we'll inform this to you in person. I'm really sorry about it again, and I'll make sure that you're prioritized for the next case. So,
Okay, doctor. You know this. My knee is pain. I couldn't use it properly. I don't know if I can walk
yes,
in my knee.
we can give you some painkillers. It will
Yes,
help ease your pain.
I'm on diclofenac, but this diclofenac has hurted my stomach also.
Oh, yeah. Diclofenac unfortunately has a side effect of producing some acidity. That most probably is the reason why you're having this problem. We can change it to a different drug and give you some better painkillers. Yeah.
Because what about my job? Maybe I lost my job because you postponed my operation one time, second time. Now you tell me you
I'm
couldn't do
so
it now.
sorry. I'm really sorry. For that, we can provide you with a sick note. We can write I can write a letter for your employer and saying an official statement that you're on the waiting list for a surgery, and this is unfortunately preventing you from walking and doing your job properly. So I can issue that, and then maybe you can should give this to your employer, and hopefully he'll understand, sir.
Yeah, it could be helpful. Yes.
Yeah,
Um.
I'll do that, sir.
Okay. In the meantime, from now until I receive your call, what I can do? I can walk on my leg.
So, like I said, I'll give you painkillers that will ease off the pain. In the meanwhile, I'd like you to, there'll be some wear and tear. So, but you should remain active,
Good.
and you can do some non-weight bearing exercises like swimming, and which will basically take the pressure off your knee, but still make sure that your knee is still mobile, and it will help with your pain as well. Is that okay? And it'll give
Physiotherapy.
you
Yeah.
strength.
Physio.
Yeah. Yes. It's okay. Yes.
Okay. So once again, I sincerely apologize. Just to summarize, so unfortunately, we can't go ahead with your surgery today. I'll discuss with Mr. Mann, get back to you on the next earliest available date for your surgery, and we promise to put you in the priority list next time as well. I'll be writing the letter for your employer, and I'll give you some painkillers for your pain relief as well. Is there
Okay.
anything
Just.
else that you want me to do?
Okay.
Is that okay?
Just be sure when you are calling me, this is a real time. I'm not come and postponed again.
We
Ask
can
to
only put
complain.
you in the priority list, sir. Unfortunately, there is a
Yeah.
possibility that
Yeah. I
we
also
can have to.
I
Yeah.
need to I need to make a complaint about your consultant.
If we can. I can direct you to the HR team if you really want to make a complaint. That is fine as well, sir.
Okay, doctor.
I will
Thank.
raise your issue to the HR department team as well. That it's getting cancelled again and again. Your case
Okay.
on your behalf. Is that okay?
Okay. Thank you.
All right. Thank you, sir.
Thank you.
Still, you have 54 seconds left.
Mm.
You were flying, but
What
more or
will-
less you've covered everything. So
We
yes,
cover everything.
yes. At the end, Dr. Zaid, you said thank you, but in this one, patient does not say thank you. Patient does not even accept the sorry of the
Okay.
resident. Resident will say again, accept my sincere apologies, and they say no, thank you, because patient is complaining. It has happened third time, so
But I am a polite patient.
yeah, yeah, you humbled.
Yes.
But he complained about Mr. Man.
Yeah.
Yeah. Even when the patient said, I want to make a complaint, you shouldn't immediately say, okay, I can guide you for this. Just you
Okay.
can tell him first, this can happen because we have a load, there is an emergency. You can explain a little bit
Yeah.
about, yeah, like
Yeah.
finally, this is your consultant. Not
Yeah.
easy to say, go and complete.
I said, well, I mean, I meant it in the fact that this is happening third time in a row, and I have to highlight this that this doesn't happen, or I mean, like, I meant it
More
in that
often.
sense. But yeah, you're right. Yeah, you're right. Yeah, I have to
Yeah. When
defend my
he said,
consultant.
I want to make complaint, this busy time
Mm.
and this emergency case, and Mr. Man is a good
And complaint is
surgeon.
not
He
going
would,
to bring your surgery or make your surgery happen earlier.
yeah, like
Yes.
this, and
Yeah.
finally you will guide him to this
At the end.
liaison
At the end,
services.
yeah.
Yeah, yeah.
Yeah.
So pulse is abbreviation of what?
Sorry.
Pulse, PALS, is abbreviation of what?
Yeah,
Please.
patient advice
Yes.
liaison service.
Oh,
Yes.
I didn't know that. Right.
You should know that. Pulse. Because complain, he has to do it at pulse.
Patient advice. Say that again. Patient
Patient advice liaison service.
advice. Okay.
What is last one?
Service.
Services.
Service.
Yes.
services. Okay, okay.
Pulse. Yes, you should know already.
Also, there is the same office for a doctor. If a patient,
Yeah,
if any doctor won't complain about another doctor or consultant, or yeah, the same office, you can go there and say them bullying by my consultant or senior. Or, yeah.
Dr. Sajib wants you to repeat once again, please.
Dr. Zai.
Patient advice creation service. Like I will write it in
Yeah,
the
you can
chat.
write in the chat. It will help them.
Yeah.
Thank you. Thank you. Started the timer, and here is the question. As you can see, it's part of breaking bad news to the patient. Right, if you have read and understood, kindly begin your communication skills station.
Yes. Okay. Hello. Hello, Mrs. Meke. I'm Dr. Sunday, one of the surgical doctor.
Hi, doctor.
Yeah. Good evening. So, can I just confirm your age, please?
Yeah, I'm 50 years old.
Okay. Thank you. So, I understand that you are here to get your result for your test, right?
Yes, doctor. I'm actually not sure what happened. A few days ago, my GP did my bloods, and he said a couple of blood tests are looking not so great. So he wanted me to come and see you. I'm really worried. What's going on?
Yeah, that's true. So I'm here to discuss your test results with you. So,
Yeah.
but before I do that, so are you here alone?
Yeah, but my husband's just waiting outside. Is it something serious? Do I need to call him?
Yeah, I think it will be better if you can call in for support.
I think he's a little, he might be a little apprehensive. You can tell me, doctor. I can take it. It's okay. You can tell me directly.
Okay, that's fine. That's fine. So,
Yeah.
like you said, I understand that you had a chemo and radiotherapy 2 years ago for your
Yeah,
cancer,
but
for
that
the
was for
breast
my
cancer
breast
that you
cancer.
had, and everything is fine.
Yes.
Yeah, and but I'm afraid your test result is out, and I'm sorry, I don't have a good news.
Oh God, what's wrong, doctor?
So it seems like the cancer must have returned. Yeah,
Sorry.
so I think the cancer might have returned. I said it seems like the cancer must have returned.
Oh, oh God. Okay, that's not good. Is it again
Ah,
my breast? But I thought
I'm so sorry.
the chemo and the radio helped.
So the thing is that the test that you did, we have the result shows that there might be some metastasis, there's some spread to the bones. But for now, we don't have enough information for now, so we need to conduct further tests to be sure of
Okay.
the exact location of the spread.
Oh.
Do you still want to continue?
Yes. Please, doctor. Tell me, is it everywhere, or I mean, which bone? Just I don't know.
So I'm so sorry once again that I'm the one that's telling you this information. So for what we know for now, we only have the details that the cancer must have spread to bones, but we don't know the exact bone In order for us to understand this, we need to run some tests, specifically scan, so that we can scan your body and we can pinpoint which part of the body or which bone the cancer has spread to. And then we can now discuss further management.
Okay. All right. When would that be? When can I get it? When will you be doing the scan?
Yeah. So I'm going to discuss with my seniors, and we'll fix it, and all the radiologists. So we are going to fix the dates for you. Then we do the scan, and I'm going to we need to discuss with the MDT. So this is like a group of professionals from different fields. So that will manage you, and I want to assure you that we are here for you, to support you, and to care for you, and we're going to do our best to make sure that we care for you in every means, by every means possible, and that you are not alone.
So what happens if the cancers come back? Do I have to go more surgery or chemo, or what does it? What does that mean, doctor?
So usually, if the cancer comes back like this and with this kind of result, so it's usually that the cancer has spread to more distant location, and in that case, surgery is already out of the case, because if we perform surgery, it will not cure the whole cancer. So in this case, the best the best treatment would rather be either supportive or to give another chemotherapy or radiotherapy, specifically depending on the location. But that I can't really say now, because we don't know the exact location yet, and we need to run for that test.
Okay. Right. There's just too much of news to digest. Okay, doctor.
I'm so sorry.
That's okay.
So do you still have any other question or anything you would like to know?
No, not that I can think of.
Okay. So can I just recap what we've discussed?
Yeah.
So maybe you can ask, does that mean I'll die?
Yeah. Does this mean that I'm going to die, or the cancer is back? So I'm worried, really.
I understand this is really concerning, and I understand this is really bad news, but it's too early to really talk about whether you're going to die or not. But first, what I would propose is that let us run this test that we need to run. Then we are going to discuss with the team of specialists. Then only then we can know what to do next, and how to combat this cancer.
Okay, doctor.
Do you have another question?
No.
So, and do you need any of the nursing staff to come be with you for the moment?
Sorry?
Or do you need me to call your husband? I said, do you need me to call your husband or any of the nursing staff?
No, thank you, doctor. I can. I'll discuss it with him on my way back. It's okay. Thank you.
Okay. So I'm so sorry once again, and I want you to remember, if you have another question, please, you can always contact me. I can always arrange this meeting again, and I'll be pleased to answer any of your questions.
Okay, doctor. Thank you.
Thank you very much.
Okay, we still have 45 seconds left. Good. Maybe Dr. Siddharth, you can begin by giving feedback.
It was really good, ma'am. I like the fact that he requested for the chaperone. And was insistent that I bring the chaperone in. But,
not chaperone,
I mean, like,
instead a sport person.
As in, yeah, no, he, you know, like I said, to know whether the patient wants to know the entire information by himself or by herself, or in the presence of a family relative.
Yeah.
I think in breaking bad news in malignancy, the first thing that we ask for is either, would you like to know, two questions that are very essential is, how far would you like to know? And would you like to know it by yourself, or would you like to know it with somebody?
Yeah.
So that was an added. He showed a lot of empathy, and it
True.
was really good. I mean, he
Professional.
explained all the doubts, and
Yes.
yeah, it
Yes.
was very good.
Very good. Yes. Yes. Anyone else want to give feedback to Dr. Sunday?
Me? Yes.
Yes, please.
In this case, when you are start with the patient, just ask here how you are since you are receiving chemotherapy, or just to open the conversation. Don't ask here, firstly, I have your test, and just how are you since you do operation and receive your chemoradiotherapy.
Actually, sorry
It
to
was
say that, but
that was 2 years
this
ago.
this was
Yeah.
2 years back.
Now
Yeah,
again,
whatever. From that time till
No,
now.
now the patient's been referred
Yes.
following blood tests. So he did the right. He's had the
Yeah.
conversation
GP
with the
did
right
the
topics. He said
GP did the blood
referred.
test and referred here. So that was after 2 years.
Yeah. Yeah. I thought of that, but the patient volunteered, some of those information when I introduced. So if I ask him again, it will look as if I did not listen to him, or because the answer I would have given me was what he gave me initially.
Yeah.
So I went with the flow.
You know what I mean. I mean,
Yeah. I understand what you mean.
when you
Yeah.
you can't tell here, I have your test.
Hello.
You disappeared.
I think he got
Voice gone.
disconnected.
Network gone.
Yeah. So I think if you can still hear me, so the thing is, because the patient was sent by the GP to me, so I have to just confirm that why the patient is seeing me today, and he volunteered all of the information himself, so I don't have to go back again.
No.
But again, that was a valid point. Thank you.
Yeah. Good. Okay. Oh, he got disconnected as well. All right. Good. Thank you.
Okay.